So we've learned a lot of things in this D.E.A.R project. Some statistics that I think are extremely important to get out there is severe gum disease. We're looking at around at least a quarter of the patients or people out there over 65 years of age have severe gum disease. And as a dentist, I'm going to tell you, healthy gums never bleed. If you think of having a wound on your leg or a cut that just doesn't stop bleeding, you would probably go to a doctor and get some attention for something that doesn't stop bleeding. It's really, really important. Gum disease is the #1 reason why we lose our teeth. So it's really, really important to take care of that. We see a number of seniors, an alarming statistic, at least a third of seniors have untreated tooth decay. And half of our seniors have serious root decay, very painful, very sore, and very rampant in the sense that that's the kind of decay that just within a few months can really travel so much so that we lose our teeth. Let's talk about some common elder dental abuse and neglect scenarios. And the #1 is neglect from a hygiene perspective. We see a number of patients living in long-term care facilities just don't have their mouth cleaned. They don't have it cleaned regularly, they don't have it cleaned daily, they don't have it cleaned properly, and there's no systems or guidelines ensuring that their mouths are cleaned. And we look in somebody's medical chart or we're doing our rounds, those are the same patients that we see that we give medicines for, etc. Is toothbrushing on the checklist. I don't see it in many of the homes or retirement residences that I see. So this, again, brings into awareness of let's create those guidelines, let's create best practices so that we're all working together as a team to make sure that our mouths are cleaned. One of the things that we really see, and I've been able to see for the last recent years, is the importance of picking a really good substitute decision maker. This is somebody who's going to make choices for you. Let's say if you lost capacity or consent next month. We start thinking in our own clinics right now with my own patients what their wishes are, what's working for them, how they want to live, what kind of mouths they want to have. But what if you lost capacity or consent next month or 2 months from now? What are those wishes that you want to see? What we're seeing is somebody's making decisions for somebody else that we feel is probably either not in the best interest of that patient or probably not what that patient would have decided. We see patients with dentures. A lot of these dentures are not fitting right. They're broken. The clasps are broken. It's not acceptable to not be able to have a set of dentures. How do you smile? How do you talk? How do you swallow? How do you chew your food? So we know that long-term care facilities, hospitals, nursing homes usually do not have a dentist on staff. Usually there's no dental clinic in these places. And so having regular preventative dental care, having a dentist as part of the team, having an oral hygiene program, these are some of the wishes and wants that this D.E.A.R project we're hoping is going to bring forth in our own community and worldwide. And we're really, really excited to get these things going on. Some of the other issues for dental neglect is the dentist is difficult to get to, so access. If you're in a wheelchair, how do you get there? Who's going to take the day off? Often visits, medical dental visits, are usually not just one appointment. There's a repeated appointment. So that plays a factor of preventing or being a barrier. And then there's the fear that what if, I bring my mother or I bring my father to the dental clinic and what are they going to say when they find what they see? How does that all work? There's a huge fear out there and there's an uncomfortableness there. Then there's the real aspect, the troubling one, where we are dealing with a demographic of patients that perhaps don't have the communication skills, perhaps they can't communicate, we can't understand what they're saying. And so we often hear, well, they're not complaining. He never says anything, she doesn't want anything. I never hear anything, and it's this complacency that we really want to nip in the bud. So the mouth, dentistry, oral hygiene, it is serious stuff. Gum disease can increase your risk of cardiovascular disease by up to 3 times. Absolutely. There's a huge link between your heart, your mouth, etc. Oral disease increases your chance of pneumonia. And this is the alarming statistic out there, that acquired pneumonia is the #1 cause of death in long-term care facilities. Pneumonia is actually caused by bacteria, an overabundance of plaque in the mouth. Well, we all probably know people or have seen or met people that just can't care for their mouths. And it's true, you can die from an infection starting in your mouth. Absolutely. Abscesses, pneumonia, these are some things that are completely preventable. And what's interesting is in the research that we've done so far, we see how prevalent oral disease, the statistics on oral disease, the statistics on neglect, and we believe that actually of all the forms of elder abuse out there, that we think that dental elder abuse and neglect is probably our leading cause of elder abuse and neglect. So seniors or older adults are just not getting the dental care that they need. We feel that as a dental profession, as we're seeing all of the statistics out there, a huge need and the lowest served for a number of reasons. 1/5 of seniors in long-term care facilities need surgery. They need extractions. They need some sort of form of removal. 1/2 of our seniors in long-term care facilities need restorative care. So you can see the importance of having a dentist as a team member within the healthcare system to ensure that the nurses, the prevention systems, and the mouth care is going to succeed, be well maintained, and keep everybody really comfortable and have a really great quality of life. What's also interesting is that seniors access dental service the least of any other age group over the age of 4. So the photo you see here is a dental abscess. I apologize for the graphics of the photo, but when we open the mouths, these are things that we see. This is an abscess right where the arrow is there. And this abscess, if it wasn't drained, if it wasn't taken care of, this person would have been in a huge acute pain, and we know that infections can be life-threatening. Some of the things that we hear oftentimes, pretty much every month, is, I think that my father, I think my uncle, I think they're too old for teeth. They don't need to have teeth, and that's absolutely ridiculous. We all need to have teeth to function. We all need to smile. We all need to speak. We all need to swallow. We all need to be able to eat our foods, and it's actually the way that our jaws are supposed to be formed and aligned, and it's absolutely one of the basic necessary cares that we should be giving to any patients, and especially our older adults. The photo you see here is a picture of somebody who hasn't had their teeth brushed in a day or two. We see people who haven't had their teeth brushed for over a week, and I have seen some patients who have not had their teeth brushed for over 3 months. I've been selective in the photos that I show you, but I can tell you that oral hygiene is an absolute necessary care that needs to be done every day. The photo you see here is actually dentures. It's a lower partial denture with the clasps, and it's an upper denture. And the chief complaint of this patient was that my dentures don't fit. If you look closely, and again I apologize for the graphics, these are dentures that haven't been taken out of the mouth or cleaned in probably 6 months. The smell, the infection, the bad breath, they were swimming inside the patient's mouth. After a little arduous work and cleaning up, we put them back in, and I'll never forget the patient said, "I love my brand new dentures. These are wonderful new dentures." So it just goes to show that patients without their natural teeth still need to see the dentist, and still need to see the dentist on a regular basis to make sure that things are fitting, there's no lesions, there's no pathology in the mouth, and that their teeth are working in the best possible way. So from a dental perspective, seniors have extra dental challenges out there. For example, we know that dry mouth is not a natural form of aging. What causes dry mouth? Oftentimes it's a huge amount of medications, a compounding effect of medications. We still don't even understand from a pharmacological perspective when you're taking 5 different medicines, 10 different medicines. We have people who come with a shopping bag of different medicines, all of the compounding effects and long-term effects on the mouth, and it's extremely real. I say saliva is like gold. It's like liquid gold. It's one of the best things that's going in our body that allows us to masticate or chew, allows us to speak. Even myself now, if I'm finding that it's hard for me to swallow or find that my mouth is very dry, it's hard for me to speak. So you can imagine somebody who's older, the same kind of thing. Seniors typically have a huge rate of arthritis or dexterity issues, especially trying to use a toothbrush on their own mouth. So these present challenges. And let's talk money. Usually most seniors do not have dental insurance that they were accustomed to if they had dental insurance. Most seniors are not working anymore. They're not bringing any money in on a regular basis, and so finances are a real issue. Here in Canada, dentistry is an out-of-pocket expense. Most dentistry services are not covered under our medical plan, and so it is seen or perceived as an extra. It's probably one of the most important types of care that we should be seeing and getting done on a regular basis. And there's a real lack of understanding of the importance of healthcare, and if you're not getting your mouth checked, and if you're not getting your mouth cleaned by yourself on a regular basis, and if you're not getting professional cleanings. Our toothbrushes go down 0.5 millimeters or so on a good day around the gums. Oftentimes when you go in and you see your dentist or your dental hygienist or dental professional, they're usually working quite hard in there for a good half an hour, 45 minutes or an hour, cleaning, taking care of your hygiene inside the mouth. That's the bacteria that has calcified, it's become a tartar, and it literally will erode the bone around your tooth structure. So it's extremely important to have that well maintained and cared for on a regular basis. Oftentimes as well, seniors need extra time. They have wheelchairs, they have walkers, they walk a little slower, they need to explain things, they have questions. Their mouths themselves are perhaps different than somebody like myself or somebody 20 years younger. Why? A lot of them have had some missing teeth. A lot of them have had heavily restored teeth. This is a demographic that didn't have the benefits of fluoride in my water or our water, and so their amount of decay, their amount of restorations within their mouth are a lot larger. Compound that with the fact that if you don't have a full set of teeth, the teeth that are left in the mouth work extra hard. And so for all of those reasons, we've got some extra challenges there just to maintain and ensure that the teeth that we do have last a lifetime.